Welcome everyone to another exciting episode of the Sourav Bhattacharjee Show. In this episode, I chatted with my colleague in UCD School of Veterinary Medicine and a famed anatomist, Dr. David Kilroy. We talked about different things, including anatomy and what we can learn from the different aspects of anatomy as a topic, and a very important topic in medical education, and where the prospects lie. Sit down, relax, and enjoy our conversation, which was candid and at the same time informative. I hope you will enjoy it. Welcome, David.
Thank you very much, Sourav.
It is my great honor to have you on my show. And I cannot even explain how much indebted I am to you as an anatomist for teaching me anatomy, to some extent acting almost as of my mentor, and always standing beside me whenever I needed help or assistance. So thanks again for all those great work you have done to me. And
my pleasure, Sourav. Thanks for the invitation.
David, we meet a lot in UCD, and but it's kind of more, not bizarre, but it's kind of nicely bizarre, or probably it's great that we are meeting in some kind of different setting than UCD, where we can have a kind of more candid chat.
Yeah.
Out-of-the-box settings, I would say. My first question, as a person very appreciative of your anatomy skills, is, tell us something about your journey. What did it take to reach such a stage of expertise and the knowledge that you have got?
Well, thanks
Tell
for
us a bit of
gracious compliments. I don't know if they're entirely true, but yes, I suppose my first exposure to anatomy, of course, was an undergraduate student. I studied veterinary medicine in UCD. And at the time, it was a very traditional anatomy course spread over years 1 and 2.
Mm-hmm.
So you'd do anatomy for 2 solid years, allied to histology, microscope slides and so on, and embryology.
So it was a traditional view of that entire anatomy.
And I think the content was probably greater than it is now. Again, there's more stuff for students to learn now, more pressure and time, and of course, much larger classes as well. So that has a negative effect, I suppose, on things. So initially, I think as a student, I probably didn't appreciate how significant anatomy was for clinical studies and for subsequent professional work. As a vet, you are required to do surgery. They're called veterinary surgeons. So unlike, say, a medical GP, where the days of the medic removing tonsils and doing surgery is pretty much gone, I think. So whereas for a vet, I think anatomy is even more fundamental.
I think so. I can agree with that.
Yeah. So I think initially I didn't really appreciate it. I'd subsequently regretted not learning more anatomy when I had the chance to do so. And of the 3 subjects, the anatomy, histology, embryology, my preference would have been for the embryology, which I found a fascinating subject. Still think it's a fascinating subject. And of course, as I said, we had an inspirational teacher, the late, great Professor Tommy McGeady, who taught that course himself and was very committed to it, had great knowledge of the subject, and of course has subsequently written a textbook on veterinary embryology.
That's like a Bible there.
Yeah. So then after graduation, I worked in practice for several years, and then...
In Ireland?
In Ireland, and I worked in Canada for a while as well.
Okay.
So then I think the Canadian winters were probably got sick of them. Not that they're spectacularly good here, but they're even worse in Canada. Lots and lots of snow. And then an academic position came up in UCD, which I applied for and got. And I suppose the rest then, I was again fortunate in starting off that there was a great wealth of knowledge of anatomy in the department. So we had Tommy, as I mentioned, George Hilton, who's now retired.
Yes,
and Michael Dorr, of course, whom we know well and still around. And again,
all the stalwarts, isn't it?
Yes. And between, among their combined knowledge would be, I suppose, over a century of anatomy knowledge.
And quite a bit more probably, because they have taken up from their teachers and old anatomists, isn't it?
Yes, indeed, yeah. So, and they were very helpful learning on the job with them. They were excellent tutors and very supportive and helpful people. So I think that was probably the best formal training you can get, is learning on the job. Because it is quite daunting, as you know, to be subjected to students asking you, what's this, what's that, and what's this, and this, and doesn't always look, in fact, it rarely looks the same as in a textbook. It's one thing to look at a pristine image.
Yeah, I tell to my students that what you read in the textbook is what is the anatomy in a living animal or living species, whereas we are demonstrating this anatomy in cadavers.
Yes.
And there is a lot of difference due to preservation issues, due to different other stuff, of course, that cadavers are not always very reliable mimic or simulating material or model for what is happening in live animals.
Absolutely,
isn't
true.
it?
Yeah.
It sounds a little bit like gone old days, because I have met late Professor Tommy McGiddy, of course, Professor Migdor. I'm very grateful. I'm extremely fortunate that I have the ability and I got the chance to work with him even now.
Yes, indeed.
I mean, he's a sheep of knowledge, isn't it?
Yes, absolutely.
So helpful, always ready to help.
Yeah.
And George Hilton, haven't met him, but I have seen his notes, which I still use sometimes in embryology. For amazing stuff. I see that what you are explaining, or the way anatomy was taught to you as a vet student, and now you're involved in anatomy teaching yourself.
Yeah.
I'm sure there has a lot of changes, sometimes good, probably sometimes less good. I mean, first question is, we are training medical graduates, but what kind of training you got as a medical graduate few generations earlier?
Yeah, well, in terms of the undergraduate training, we did spend a lot of hours doing anatomy. And it was allied to other subjects like physiology and biochemistry, but I think they were very discrete subjects and, very separate in their approach, which now I think it's much, much better to have them blended together. So for example, yes, exactly. So for example, your module, you don't just do anatomy, you talk about function, origin, and I think to integrate that makes it much more digestible for students.
And palatable as well.
Yes, yes. So,
but
it does give them an overview of what the subject's about. I think to look at things in isolation is a mistake. And if you spend a lot of time looking at biochemical pathways, it's hard to see, unless you're explained where they fit into the body and why you need to know them. It's not purely reciting things from memory. So I think the new approach, the integrated approach to anatomy, I think is much, much better for students' future knowledge. And I think it makes it more understandable and more relevant to their current studies. And I think the emphasis on clinical approach to anatomy as well, I think, again, is much more relevant. I think there's little point in learning, every bump and every bone in the body isn't something they're ever going to need to know. And it's just, kind of storing up stuff in their brains, which for the purposes of exams, which I think we should try to get away from. I think current disadvantages, I think, are just the sheer number of students.
So you mean there is an inflated class size?
Yes.
Isn't it?
Class size, it used to bump around 50 to 60 here in Dublin. And we're up, as you know, well over 100 now combined.
Yes.
And I think that puts a lot more pressure on the teaching staff. But in addition, I think the students have less access to staff because our numbers are static or falling, and people are pulled this way and that. Again, I think like any job now, there's so many components to it.
I was reading quite few articles, especially in medical education.
Yes.
These issues that you were saying, that there is inflating class sizes and shrinking resources, these are very well documented, and it's probably very much a global issue now.
Yes, I think so.
The demand to enter medical colleges has quite increased, the resources. So this is a very interesting discussion, actually. Then before I go actually there, I will just like to touch upon, because you are working as a lecturer in UCD School of Veterinary Medicine, just give a kind of a brisk overview of your duties there. What does a typical day of your life as a lecturer in UCD looks like? Yeah,
well, during term, there's, substantial amount of teaching.
Yes.
And we might have a couple of lectures a week, which again, I suppose is decreased over what it used to be, which again, I think isn't a bad thing. And then quite a lot of practical classes. So again, we're limited in the number of students we can have in the practical room at any one time.
For health and safety reasons also?
Yeah. And I think for education experience
purpose,
as well. I think it's important that they're not just a whole hundreds of them crammed in like sardines. So I think usually we run the practicals 2 or 3 times, which is a bit repetitive, but probably manageable, I suppose, given that there are a few staff involved in it. And we're very fortunate in using some of the clinical year students who help as demonstrators.
And they're usually good.
Yes,
they're very good,
prepared,
very capable,
committed, and they volunteer for this job. So they're obviously ones who are interested.
Be grateful to them, isn't
it?
Yes.
Yeah. And I think the undergraduates are very grateful to them. Yeah. And they're more forthcoming with them, ready to ask what they consider to be a foolish question.
Yes. I think, encouraging students to actually interact and not to be scared or not to be apprehensive of asking a question.
Yes, I think.
Because the student is afraid that he or she might be labeled as crazy or, as you said, foolish. Yeah. That's not a good idea.
No, I fully agree.
Students should be encouraged to ask questions.
Yes, regardless of whether they think it's foolish or not. Yeah. But I think, again, I would hope that, by using fourth years and final years as demonstrators, that can serve as kind of a bridge between the undergraduates or the younger students and us, if they are willing to ask that.
Yeah.
Now, they are inclined to be a bit more forthcoming with them, say, do we need to know this and do we need to know that, and so on and so forth.
So what I understand, I will just take over there, that a lot of your time is about interacting with students.
Yes.
And I'm sure you are giving plenty of lectures as well. There are a lot of lecture materials. And how much do you think we should rely, and this is just your opinion, it's not a policy as such, but because there is a lot of noise and interest, I would say, in using digital platforms in anatomical education. Even people are very interested. I have met a lot of colleagues, and some of them, through the virtue of being members of Anatomical Society, who are very interested in social media and how to use them, using survey polls and giving especially formative assessments for students with MCQs. And sometimes I have used them. They work well.
Yeah.
But I am just only asking for your view. How much do you think that these upcoming digital platforms have the merit to replace traditional cadaveric dissection, or do you think cadaveric dissection should stay or will stay where they are as kind of gold standard, but social media or these digital platforms can be very nice to facilitate on top of that, especially for exam preparation?
I think certainly the latter approach, where we do have some dissection. Again, you probably could reduce it, which again would be a good idea in terms of refining, reducing numbers, refining.
I totally agree, yeah.
I think to completely scrap it would be a bad idea. I think by and large students enjoy the dissection classes. They're working in smaller groups. Mm-hmm. They can kind of discuss things among themselves, and it's easier for the supervisor, the staff member, to interact with a small group. And by and large, I think they get something out of it. And most of the time, they do a very good job. Mm-hmm. I do think probably there is a case to reduce it on welfare grounds, and to be sure that we're using animals to the ultimate degree that we can.
So we need to reduce, we need to refine, and of course, that's also ethically more aligned.
I would think so.
Yeah, I completely.
And I think, again, but there are certainly some superb online resources. Mm-hmm. There's great developments in virtual reality, mixed reality, augmented reality, where you can do incredible things. And, you and I have both been exposed to some of the things that are happening in computer science. And
fascinating stuff, isn't it?
Yes, I think that marrying the two, the anatomical knowledge and the computer science knowledge, can be very positive. And I don't think it can fully replace it, in my opinion. Mm-hmm. I think there are limitations to it, but I think it's good for students to actually do things with their own hands, where they're doing something rather than tapping away at a keyboard or mobile phone or something, where I think many of them probably spend too much time as it is.
Yeah, I kind of buy that argument, but my own feeling is that probably, as you said, dissection will not or should not be completely replaced by this emerging medium.
Yeah.
But they are certainly, I have found them very helpful in engaging students more and engaging them in non-tuition hours when they are in their private space. Yeah. It does make anatomy probably a bit more interesting, and students find them engaging and just not a subject which I think medical graduates have always been scared of anatomy, finding it loads of information that they think they have to just grab on, isn't it?
Yeah, I think that is probably the main failing of the subject, that we haven't made it, as you said earlier, palatable to students.
Palatable to students, or even interesting. Or So I will take merit of that social media platforms, actually. The infographics is great.
Yes.
The accessibility is high. Everyone has these handheld devices. Yeah. So there are certain merits which I do see.
I think there are enormous benefits, And of course, the fact that they can use them anywhere, anytime. And the other thing is that students can who finished anatomy can come back, say, 2 years later, when they start doing ultrasonography and radiography, and suddenly they have to remember all these bones and joints and everything, and can review the material at their leisure.
I completely agree. And at the same time, with more and more decades, I think the amount of valuable resources that we are having right now available online, and sometimes completely free of cost.
Yeah.
And I sometimes look at them and I get very jealous of the current breed of students, because when I was a student, medical graduate, and I'm sure when you were a medical graduate, we never had these resources, isn't it?
Absolutely right. Yeah.
We were very much on a 2D table, 2D visualization of a cadaver. Yeah. This 3D stuff is changing the game, I believe.
Yes, I think it is. It's phenomenal. But I think probably one of the risks is that there's an excess of the material. And it would be nice maybe for us to decide this is superb, this is okay. A bit of guidance, I think.
So where to stop?
Yes.
How far is too far?
Yes, if the student just has an endless menu of things to choose, you go out to dinner and there's 15 pages of a menu. Well, what will I go for?
So you say that students also need some kind of not restriction, but some kind of guidance where to stop, some kind of threshold that this is what you need, this is what you don't need, or don't need means not at this stage, probably.
Yeah, I think given their time is limited to everyone, so I think for saying this is perfect for you at this stage, if you happen to have an interest in exotic species or ferrets or horses, go and look at this other material, but it's not part and parcel of the course. It's not going to be on the exam, which is what most of them are focused on at any one time. And that gives them some discretion as to what they should look at and what they shouldn't. But, you don't want to put limits on their education, but at the same time, you don't want them thinking they need to look at all. Yes, exactly. That they're stuck looking at all these things that don't have any real immediate relevance to
relevance, probably.
Because it is a pressured environment, as you know. The time goes quickly. The exams are soon looming on the horizon. And, then suddenly it's all on top of you. So I think it's hard to...
It's all...
But certainly it's very positive, and some of the material that's out there is absolutely incredible, as we've seen at various conferences.
There's a lot of interest in the academic sector there. David, you teach whole body anatomy. So which part or segment of whole body anatomy have you found the students struggle the most, and why?
I think probably with the head region and the brain.
So head and neck.
That's my impression.
Neuroanatomy.
Yes, I think so. I think the complexity of the nervous system might be one of it. And it's not something you can memorize, I think.
No.
You can memorize bits of it, but it is something that's kind of, you have to understand it, I suppose, or at least to some degree. And of course, it is very complex. We all know the brain is an incredible
super complex,
structure.
I would say, because I teach anatomy, and even now I had a lecture recently on pharyngeal arches.
Yes. Indeed.
And all those things, the design, and it is complex.
Yeah.
There is no second opinion about it.
And then in addition, in the head, there's so many, there's something like the eye and the ear, which are very, very important, and yet complex structures in themselves. But you also have bits of the digestive system, respiratory system, and so on. That, so it's kind of brings in multiple body systems quite complex anatomy and then the brain itself. So I don't know. I think the modules involving the head and nervous system probably have excessive content. And I don't know if they should be dismantled and take the brain out of the head, for example.
Yeah, these are disputed topics, I would say.
Again, I think the nervous system is a difficult topic anyway. And because it's splintered across pharmacology, cardiovascular, head and nervous, it becomes, I think, probably worse. Abdomen. You teach
pelvis,
you teach quite a lot of autonomic nervous system. So, again, all of these things, I think, make it probably more daunting than it needs to be. But it is an extremely complex system and an important one, even in animals where there's a lot less neurological interest than there is in medicine.
But actually, this brings to another interesting point, which I would like to raise, that animals, like you said, we just made a statement about the neurological interest. Of course, I think in animals, even in advanced vertebrates other than Homo sapiens, the neurological complexity is relatively less when I compare it to humans / Homo sapiens again. But I mean, coming from a human medicine background, I'm a human doctor or graduate, and coming and kind of swapping my field towards veterinary medicine where I'm teaching anatomy. I do see the relevance of veterinary or animal species learning anatomy about them, because there is, I think, over evolution, there has been a gross kind of a template for vertebrate evolution. And what veterinary medicine has given me that opportunity to look over to animal kingdom, not through the lens of Homo sapiens or humans only, but through a gross perspective, which is the One Health perspective.
Yes, of course,
And I know you're super enthusiastic about One Health. Give us a little bit of introduction for our audience as well.
Yes, of course.
What is One Health?
One Health, so it's how things are integrated, I suppose. The environment, animals, us, and various organisms that cause disease and how we're all integrated together. And it is kind of, I wouldn't say unique to the vet schools. I think there's a bit of overlap with agriculture as well. But sadly, it doesn't have much resonance when you speak to medical colleagues, for example. They just say, what's One Health? Never heard of it.
Yeah, I have.
Maybe not quite at that level, but it doesn't have the same importance or...
it varies over discipline to discipline.
Yes, or profile that you get in the vet and agriculture world. But it is enormously important as to how we're all interrelated, both as species and sharing the same environment and maintaining a kind of sustainable environment. So there are lots of good things happening in it, but they don't appear under, I suppose, the umbrella of
it just doesn't spread homogeneously throughout the cohort.
Yeah.
That's what you were saying.
But it is, just going back to what you said about comparative anatomy, that is a fascinating subject. Even looking at various skeletons that we've seen from zoology, it's quite remarkable how they're constructed and the adaptations that have occurred. Now, sadly, in our course, we don't really get time to
get through this.
But it would be a lovely module to teach, and I think a lot of students would be very interested in it.
It's an incredible module, and the different types of adaptations. I mean, you remember the publication that we had in Journal of Anatomy. We just brought some of the instances
of course,
incredible flexibility of life forms. And I think from the comparative anatomy perspective, there is so much even I learned as authoring that paper. And I do see that there is a fissure between the knowledge that is happening in the School of Medicine and School of Veterinary Medicine, even the Department of Zoology, I would say. I mean, there is a huge space for collaboration.
I would agree,
The collaboration and sharing of knowledge.
I think and given that we're on the same site, we're a stone's throw from each other. I mean,
there should be more collaboration.
You would think,
and not only in UCD but in every medical school or higher institution.
It is a pity that I don't know if maybe people are just too busy or stuck in their own kind of.
No, it's not always easy. Also,
but it's given the overlap between the disciplines and subjects and the areas that are potentially suitable for collaboration. It is a pity that there isn't.
And there is a lot to learn from each other.
Even groups like anthropology, they're constantly digging up bits of animal bones and so on. There's a big rooms of them over in one of the UCD buildings, but you just happen upon these things. And so I don't know. I don't know if people don't have time or if they don't really get the opportunity to see outside their own.
It's a mix of everything, probably, isn't it?
Yes, I suppose so,
Yeah. I mean, from this conversation that we had, I think what we can agree, and we do agree, that this evolution of vertebrate life forms has kind of followed a template which is shared by different species. I mean, that makes evolution itself a very inclusive subject. That's what I find. And species, there is tremendous amount of speciation in this world. So there is diversification through species, but at the same time, the core templates, the embryological templates, the developmental templates, the histological templates throughout these anatomy modules or anatomy courses, they remain pretty much the same.
Yeah.
I mean, tell me a little bit about are you doing any kind of this evolutionary research or morphometric research?
Yes.
Because there is also a lot of interest in computational derived models. Tell us a little bit about it.
Yes, there is quite a lot of work going on in that area. But I like the comparative anatomy aspect, I think, as we've discussed, is fascinating. So recently, as you know, we've colleagues in Spain who plastinate materials for us. And one of their students was doing his doctoral thesis on the head development in the dolphin.
Yes.
So he was looking at it anatomically, and given that he said the knowledge base is quite poor, and it has, again, interesting anatomy and physiology, which is studied a bit, but not to any great extent. So this was to kind of clarify the anatomical features of the head region. And they did a lot of CT scanning. His job was split between the university, where he's a doctoral student, and he worked for the Spanish government, where they have any stranded dolphins or whales came to him. Because, as you know, the Mediterranean, there's a narrow gap between the Mediterranean and the Atlantic near Gibraltar, and that seems to be a common site for stranding of these species. So he would get access to all of these specimens, and they CT scanned the head region, and then UCD, we got access to these heads, the scans of the heads, I should say. And we were able to do quite a lot of image analysis using things like Fuji or Image J. Fiji, I beg your pardon.
Yeah, Fiji and Image. Yeah, Fiji is just an advanced version of Image J. So a lot of image analysis.
Yes, and students were involved in this project.
And we have also used 3D Slicer, another freeware, which is extremely nice. And we have students working on that in collaboration.
And of course, the feline humorous work,
model, which we are trying to publish somewhere.
Indeed, But all of these things, so the morphometry, I think, is something that can give a useful template for further studies. There was a group, a student in Liverpool and a student in Dublin, collaborated on some CT analysis of the canine and feline pelvis to see was there any evidence of osteoporosis in older dogs and cats. So that was a nice project for students to look at. Again, they can do it cheaply. They don't need any expensive equipment, just a computer, some free software which they can download, and then their knowledge base. Yeah,
it's very knowledge based, and it's very engaging as well. It makes things interesting.
Yes, of course.
Other than this type of evolutionary or morphometric research, I guess you are also collaborating with School of Engineering.
Yes.
And give us, if it is not too confidential, tell us a little bit about it.
There's nothing secret about it. The engineering school, they were looking at some specific bones, what we call sesamoid bones.
Sesamoid bones,
which, as we know, are bones that are in tendons.
Yes.
And I had spoken to somebody over there, a student who was interested in doing he was enrolled on the master's program in engineering. So as part of that, they have to do a thesis. He was quite keen on bioengineering. So through a colleague there, Alan Carr, we chatted about looking at sesamoid bones, because I thought they were unusual bones having an excellent blood supply. These bones are embedded in tendon. How are they nourished? How do they remodel? Do they change? Do they expand? So we acquired numerous sesamoid bones from some of our canine cadavers, which is a nice way of reusing the material. He has a big crushing implement over in engineering where they can test stainless steel and the tensile strength of various structures or substances. And he was able to crush the sesamoid bones and use some, I think it was Hounsfield apparatus or something to get the...
So if I understand, so there was stress, mechanical stress created on that.
They put the bone on a small plate or the straw, whatever it is, it could be your pen.
Yeah.
And then they just keep applying so many newtons of force until the thing cracks. That's the breaking point. And then they can construct some
mathematical
elastic
models and elastic
modulus.
Yes. And any interesting findings?
Yes, it was quite interesting because our initial hypothesis was that given that the forelimbs or the front limbs of the dog take about 2/3 their body weight, the sesamoid bones would be denser and harder to crack, that they would remodel in response to weight bearing, which is the conventional theory. Now, as it turned out, the sesamoid bones of the hind limb were far denser and much, much more difficult to crack open.
So your hypothesis was kind of nullified by the results.
Incorrect, yes.
Incorrect.
But at least we did have quite a lot of data. And the student, Martin, got a nice thesis out of it, which read well and so on. Hasn't published anything based on it, mainly because he went off to work in industry, and I suppose it's...
But as a researcher myself, I mean, so you made a hypothesis based on traditionally what you expected the forelimb sesamoid bones to be more robust.
Yeah.
But that did not happen.
No.
It was, if I may say so, almost reversed.
Yes, exactly. It was
experimental results.
Yeah, the opposite of what we expected. Yeah.
Why? Do you have an explanation?
No, I don't. Well, I mean, we did think then that it had some sort of lever function in the hind limb, given that that's the propulsive limb, and that somehow the sesamoid bones, but we didn't follow up. The work is still pending. It could be followed up quite nicely.
Is it because the hind limb muscles are relatively more bulky? They're able to produce sleep?
They tend to span several joints, so maybe they act as a... But again, it's purely guesswork.
Guesswork at this stage. So there is no kind of... But these things happen in research, isn't it?
Yeah, but it was still an interesting project. It was nice to get the engineering aspect of it and to sit in on some of the similar projects which are being done. And then the other area, of course, where we both have collaborations with is computer science.
Yeah.
Which are very, very interesting because they're up to date in modern technology.
Yes, they're very tech-savvy guys and they are doing incredible stuff.
Which is a full-time job in itself.
Yeah, full-time job in itself. And developing these models. And I met one of my colleagues in computer science, and he showed me all this new stuff he's putting in Oculus glass and everything.
Yeah, it's incredible.
It looks incredible. It's something out of the world experience, if I may say so.
Yeah. So I think that has great potential, certainly in the educational field. And interestingly, one of the outreach bits that we've done is with the University of Colorado.
Yes.
And they use virtual reality to assess anesthesia in their students. So that was fantastic. So you're given the patient, you calculate the dose of pre-medication, the anesthetic dose, how you're going to administer it. The VR will show you what's happening to the dog or cat or horse or whatever it is. So I thought that was a great way to use it. And quite innovative and interesting to students too, because it's better than scratching something down a bit of paper, I think. Certainly.
It's more hands-on.
Yeah, it's a bit of a change.
It's a bit of I would say even more than bit of a change.
Yes. So again, I think computer science is really a fascinating group to collaborate with, given their knowledge and their
capabilities.
Yes. And the fact that they're so into things like virtual reality and augmented reality.
So what I understand is you are collaborating within UCD School of Veterinary Medicine. I know we have a conversation sometimes with School of Medicine. Now you're collaborating, you're crashing bones with School of Engineering.
Yeah.
It seems pretty multi-dimensional, multi-pronged collaborative effort that you are going through in your research. Is that, I'm sure you enjoy this much of collaboration, isn't it?
I think so. I think it's good. One of the big advantages to UCD, I think, is that we're on a full campus.
Yes.
As you know, lots of medical schools and vet schools are cast adrift from the core campus and operation kind of in their own bubble, for example. Yeah. So I think it's nice to be on campus with everybody. Yeah. Again, as I said, the interactions are often limited because people are busy. You go in, you do your job, and you go home. But there are still opportunities for overlap, collaboration, discussion. I think that's a very good thing.
If you can pick up one topic that has really made you interested and you would like to investigate as a researcher, you find incredible?
I think odd features of anatomy. Guttural pouch in the horse, for example, is very strange.
Yes.
And, for example, the cow has a bone in its heart, which is a very strange thing. Function, do we know? Have a clue what it does? Or we can speculate. It could be biomechanical. It could be source of stem cells. I don't know.
Yeah.
Again, something like that, which is found in all these bovine species. And I think these oddities are the foramen in the humerus, the feline humerus, for example, again, a strange phenomenon with no real explanation as to why it's there. Now, again, nobody's going to fund that type of work, but it's nice as curiosity. I think it keeps you interested in why these things happen. Again, it goes back to some of the earlier talk we had about evolutionary developments and the evolutionary template, and it makes it, it's not something that's going to win a Nobel Prize or get recognized for a presidential award or anything, but it's still satisfying to investigate.
Yes, scholastically very satisfying.
Yes, even though it's not, the world isn't going to change if we find out what the supracondylar foramen in the feline.
No, it can have a long-term
Well, it
effect,
might, but I can't imagine that we'll be booking our flights.
We can learn more.
We won't be booking our flights to Stockholm, I don't think.
No, that won't happen.
Yes.
But it will be very satisfying.
It would, yes. But a nice little thing to wormian bone, these strange intrasutural bones in the skull. Why do they occur? Why are they there? That was a collaboration with engineering as well, which was quite an interesting
one.
Because again, you learn a lot about physics and stuff.
You can merge everything.
I think that's a great thing if it can be done. In fact, it would be nice if there were some kind of beginners classes for biologists to learn physics and the reverse, just to bring you up to speed on the subject so you're not totally clueless.
Aware of her.
Yes.
Last question, as such, in this kind of interview. Do you think comparative anatomy and holding hands with comparative anatomy, the concepts of One Health, should be made an integral part of modern medical education? Doesn't matter on human side or on veterinary side. Because I have a feeling there is a kind of, I wouldn't use the word ignorance, but I can see that more and more these type of issues, that some of which we have chatted only, but we are mostly confining ourselves to domestic animals. There's a huge wealth of information, knowledge on the animal side around us.
Right.
Do you think we should make it an integral part of our medical curriculum? Because that will help us.
No, I think it should be. I think certainly in first year students it should be fitted in somewhere. I think just as an introductory concept to realize that there's a big animal kingdom.
And we humans are somewhere a dot.
And we're all interdependent. Just to give them concepts of how big and complex the world is. And I think just to awaken their interest in it. Because lots of students have other interests. I think one of the problems with very busy degrees is they almost get into kind of a tunnel of just focusing on their own subject with the purpose of passing exams, which of course is their primary aim in university. But at the same time, you don't want to
make you too myopic.
Yes, you don't exactly. Yeah, you don't want to just the experience to slip away, because then you're in the workforce and you're in a different environment.
Yeah. Giving our medical graduates the idea of this interdependability of different species and not behaving arrogantly as humans.
Yes, well, that's true.
Not creating stress to environment. That is not only important for them to rearing them to be good doctors, but at the same time, it will be certainly very nice to this planet that we call home today, and that we have not done too good to her.
Yes, that's true.
So it's also very important from the sociological perspective, I think, to understand this kind of interdependabilities. Well, I must say this conversation can go on forever. Today we could only touch or even scratch on the surface of what we could discuss. But listen, thanks a lot.
Not at all. My pleasure.
As I said, the pleasure is, of course, also mine. Yeah. And I'm really, really grateful. And hopefully, in the coming years, with subsequent seasons of this talk show, you will be coming over again. And we will be discussing more interesting stuff interesting for audience, interesting for medical students. And what can I say? Thanks a lot again.
Not at all. My pleasure, Sourav. And I'll see you next week. We're back in our normal
back in our normal life, isn't it?
Yeah.
Thanks a lot, David.
Okay.
Thank you.